Hey, Dr. Lindsey and Wendy here. We're going to go through 3 cases real quickly. These are 3 life-changing
results.
And those are the words of the patients that got back in touch with us after a year. So case 1 is a guy roughly my age, lives a couple hours away. He came in with a little tuft that you can see, but bald everywhere else. And we did, I think, 3,500 grafts on him. And here's the grafts in place, and it's the end of the case. Notice that we put a rubber band around this little tuft at the front so that as he got past the first week, he could essentially look like he looked before. And then I saw him at 9 months, and he looks good. If you look carefully right in the center of the front, it looks a little weak, and that's where we did not work. That's his pre-existing tuft. Then I ran into him at a medical conference at a year, and that's pretty good flowing hair from the side. My scar is almost impossible to find, but you can comb that hair, pull on it, do whatever you want to with it. It looks really quite good.
It looks real good, yeah.
And then Wendy and I went to see a cover band, Led Zeppelin cover band, and lo and behold, we ran into this dude right at the stage, and I had to block out his face because I don't have permission to use it. But that's pretty good hair. That's 3.5 years out. He'd gotten himself a young girlfriend, and I've heard from him once or twice since then. He's gotten married and moved up in his corporate world, and it's a home run, right?
It is. Yeah, he was very happy that day.
Yeah. So that's case 1. Here's case 2. This guy's a younger guy. He's in his 30s, has a short haircut required for his occupation. He's spent a fair amount of time in the stands. Yeah, Pakistan, Afghanistan, Kyrgyzstan. He spent a lot of time over there and came in. And this was taken in 2010. He also has that little tuft in the front that he was convinced was going to stay. And when he bends over, man, there's no hair there. And he's a class 5 hair loss, needs a relatively short haircut. 17 months with a little bit of mousse, that's a home run.
That's amazing. It looks really good, yeah.
And his wife, who still comes for Botox, it's now 7 years since we worked on him. They've had 2 kids. I think another one's on the way, and she loves the rubber hands to that hair.
Yes.
And that is good. That's an awesome result.
It is.
From the side, this is all at 17 months. That's Wendy combing it at 17 months, and the other side. And then the wife brought these pictures in at 3.5 years. Again, this is 3.5 years ago. She took this at home. And that's, on a bleak view that she took it home. That looks pretty good. Dining room lighting looks pretty good. And he's happy, and more importantly, she's happy.
She's happy, yes.
Yeah.
She was the one that wanted.
She's the one that wanted the hair transplant, which is not uncommon. And then the third case is a guy that some of you guys might have seen before. I'm really proud of this guy. So a wig-wearing guy about my age that had irritation in his scalp from wearing a wig. We did a hairline that matches my hairline, which is what we shoot for, with some irregularities out in front so you don't look unnatural. And 26 months out, man, it's awesome.
Yeah, for this guy, definitely was life-changing. He used to spend 2 hours gluing that hair piece.
Yep.
Yeah, he said it's definitely life-changing for him.
And you can comb it and do whatever you want to do with it. And he's got a little video testimonial on one of our other YouTube videos. I'll try to put a link up to that. But again, he wears short hair just like the guy in front of him, and our scars typically are difficult to find. So, in summary, with good attention to detail and proper cleaning and good suturing technique, we can usually get a scar that's difficult to find and really great results.
Results like that.
Yeah.
And there are different types of hairs, you can definitely expect results like that.
Yeah. So if we can help you, give Wendy or me a call. Thanks.